Hello friends, I hope most of you have just been seeing and viewing our latest video in which we created the journey of the establishment of Central India's first and exclusive homeopathic oncology unit in Amravati under the supervision and able guidance of one of the renowned international homeopathic teachers, Dr. Sunirmal Sarkar sir. As you can see, this center is just because of his guidance and the collective effort of our team put together. We are running quite successfully since the last 5 years now. The reason I am talking to you today is I just want to share with you what's being happening and the work of Dr. Sarkar sir. How we learned from one of the most legendary practitioners of today, Dr. Sunirmal Sarkar. Nowadays, friends, we all know that there are many approaches, different schools, different thought processes. Some people consider repertory as an essential part. Some people don't consider repertory at all. Some have theme based prescriptions. Some people have conceptual prescriptions. So, there are a variety of things happening with modern advances and latest developments. There are different schools set up also. But Dr. Sarkar sir, I want to emphasize it to you. His approach, if I have to sum it up in just one single word, that one word is his homeopathy is absolutely simple homeopathy. What he just basically does is, in any case, irrespective of the diagnosis, he tries to hunt and elicit the most peculiar symptoms. And if he gets a few characteristic symptoms, he relies on that, and that makes it the foundation for a good prescription. Now, these characteristic symptoms can be either from the pathology itself, can be from his mind state, can be from his organ affected, or can be the past history, or can be the family history. Anything is very, very important. And an innovative thing he has done in homeopathy is the history of the drugs the patient has taken till now. So even the drug history is a very essential criteria which Dr. Sarkar definitely pays attention to. So I'll just share a couple of cases of how he does it. So let's see. Case 1. A 34-year-old female approached with a case of hypothyroidism, and she had this since her puberty. She had extreme weakness, lethargy, and a goiter. In addition to all these symptoms, she was severely constipated and she had tongue on which there were imprints of teeth. Emotionally, the patient didn't have hope. She was extremely depressed and she was constantly aloof, isolated, wanting to just end her life. So, all these symptoms, as we all know, are very peculiar of aurum metallicum, and that's what was given, but there was no effect of aurum metallicum. How did Sir analyze this case? He gave a remedy, hydrastis. Yes, dear friends, hydrastis for this case. And after giving hydrastis, just in a couple of weeks, the lump resolved, and a follow-up of almost 2 years or more, the patient is perfectly fine. Now, how did he come to hydrastis? So as you can read it from Borik's Materia Medica, Borik writes, the tongue of Hydrastus has peculiar characteristic of imprints of teeth over the tongue. And like Aurum Metallicum, you see Hydrastus also has desires for death and extremely depressed. So this is a not so well known symptom of this remedy. Now what is the most important thing of Hydrastus? It covers the pathology also. How? You can see Borik writes, Hydrastus is effective and suitable for conditions of goiter which have their onset either in the puberty or during pregnancy. So nowadays we see a lot of gestational thyroids coming up. So please remember, Hydrastus is one such remedy to consider. Let's move to the second case. You have a very senior 80-year-old man coming with a condition of inguinal hernia. Now he was advised surgery immediately, but he wanted to try homeopathy first. On his physical generals, the symptoms which were explored, he had craving for sweets, aversion to onion, and he was a hot patient. He had coryza in damp weather, and what was clinically observed is while he was coughing, there was distension in the hernia along with pain. On these symptom totality, Sir chose for him calendula. Yes, you heard it right, calendula. What happened? The surgery was avoided and he remains fit and fine. This is a very, very important case, and Dr. Sarkar says that this is one of his own landmark cases in which he learned the scope of a simple remedy like calendula in such condition. Now the beauty of this prescription, as we see now in Borik, what he writes, great disposition to take cold, especially in damp weather, as well as we have the symptom of distension of the inguinal ring along or worse during coughing. So that's the beauty of the prescription. These two cases are just simple examples of how he makes homeopathy very, very simple. So if we practice on simple homeopathy, basic, conventional, fundamental homeopathy, results are truly remarkable. That's how our masters have prescribed. That's how most of the homeopaths today prescribe. That's what I learned from my teacher, Dr. Sarkar sir. What is important now? To learn from such a legend, and we bring to you a very rare opportunity in my town, Amravati, to come and explore the work he is doing and to gain from his knowledge and enhance our own skills. And then we are ready to evolve in our practice with such simple, fundamental guiding principles and techniques which are very, very simple, which can be easily replicated. You can learn, and this learning opportunity is very soon happening later this year. And if you have challenges in your clinical practice and you want solutions so that you are better equipped to handle such conditions, then well, we invite you to Amravati. We did the first mega seminar of Dr. Sarkar way back around 6 years ago. It was done in 2013, and I am very, very happy and pleased to inform all of you that we have him back in 2019 after a long period of 6 years. So these are the details, my dear friends. He is visiting here for a 2-day workshop, and the topic is very simple: meeting clinical challenges with homeopathy. It's as simple as it gets. And the dates, please note it: 30th November and 1st of December 2019. So it's Saturday, Sunday. The details are on your screen. What we have done, in just brief, I want to let you know, is on the first day we have the morning session and the noon session divided into 4 important clinical sessions. Out of which the first session he will be talking about his own learning from his gurus and from the legendary authors, the books of which all of us read, the vast knowledge literature bank of homeopathy. From Dr. Farrington, from Dr. Lippy, from Dr. Kent, from Dr. Tyler, from Dr. Burnett, you name it and he will speak about it. Then his own clinical learning as a student from his great gurus like Dr. P.C. Paul, Dr. M.M. Datta, and such legendary people. So he will be giving us his learning experiences with his master teachers. I think that will be very, very interesting to learn the Guru Gyan from today's Guru, Dr. Sarkar. The second session, he will be talking about day-to-day clinical practice. What most of us face: cough, coryza, joint pains, sciatica, gastritis, diarrhea, simple things, skin conditions, allergies. So day-to-day practice. And post-lunch we have 2 special sessions. The post-lunch session begins with talking specifically about bronchial asthma, both in the pediatric age group and in adults. I think most of us have this very, very common in initial days of practice, and of course later also, because bronchial asthma, as you all know, has tremendous potential of homeopathy. So we thought that it would be best addressed and most people could benefit from a legend who practice and has an experience of more than 4 decades now in homeopathy. So we'll be able to learn from his clinical wisdom. And then the last session on the day 1, he will be specifically talking about management of antenatal care and labor with homeopathy. Interesting? Yes, because this comes from a clinical experience of having conducted more than 1200 labor process. Yes, you heard it right. More than 1200 labor processes successfully conducted with homeopathy by the legend himself, Dr. Sarkar. So I think it is very, very important for us to learn and know how he managed ANC, labor, and after labor, if there were any complications, postpartum, we could learn from him and benefit in our practice. This is day 1. Day 2, my dear friends, will be talking about the highest clinical challenge which homeopaths face, or should I better put it, which most of the physicians and surgeons face. The medical world is today facing one of the most dreadest diseases on the planet, and yes, you guessed it right, it's about cancer. And like most of you know, Dr. Sarkar has been recently awarded a PhD just this year for his work on cancer. And I want to tell you, it gives me great pride that out of the 30 cases which he submitted for his approval, 10 of those cases come from our clinic here in Amravati. So it's a great matter of pride for all of us. So day 2 will be the forte, the vast clinical experience of managing all sorts of cancers. And I think it will be a very exciting and enriching learning experience for all of us. So we look forward to meeting you all, to join us in a great learning opportunity. And there are some of the details. You can please subscribe to this YouTube channel we will be regularly posting updates and the learnings which we got from Dr. Sarkar. You can write to us on our email. If you have any queries, we would be very happy to address the same. Thank you.